Yeah, that's fine. And I'm going to pass the ball to Carol.
I'm a Library and Knowledge Services Manager for an integrated service which covers acute, mental and community health. I national work for PPI for NHS Libraries and Health Education in England for 2 years, from 2015 to 2017. But I'm actively involved in PPI work. In a previous role, it was a clinical librarian for a cancer centre. As such, I'm really passionate about ensuring patients and the public are signposted to trustworthy, reliable and up-to-date health information. What are we hoping to do in today's session? Hoping is that I'm sorry, I have started the wrong slide, sorry.
That's okay.
There we are. Two. So if you join me tomorrow, you've already had a quick preview.
Feel free just to start again, Caroline, and we can just, with the recording, that's fine, just go from the top
That's
again.
Absolutely fine. Well, my introduction was exactly the same as tomorrow's, so there's no problem there. Just a slightly different emphasis for different audiences.
John.
So what we're hoping to do by the end of this session is that you will have a greater awareness of why the public needs health information, that you will have some resources and techniques that will help you assess the quality of websites, know some good quality websites to use, and also you will be able to find the material available for you on the Knowledge for Healthcare website. So if you remember back to the beginning of 2015, when Knowledge for Healthcare was first issued as the NHS Library Strategy, we were surprised at the inclusion of patients and the public as service users. But from this particular vision, the PPI Task and Finish group was formed, and many of the resources that we're going to look at today were developed by them. This was just an extension of the work that I was already involved in. For example, if you think about it, we often have queries from clinical colleagues about the evidence behind some of the information presented to them by their patients as regards their treatment or potential alternatives. And this information has inevitably come from the internet, and the majority of it from less reliable resources. We think about our number of literature searches, but also if you think of lots of those interlibrary loan requests, they support patient information, albeit in a very indirect way. Look at the important question: why do patients and the public need this health information? Well, the famous cartoon by a chap called Steiner, which is called On the Internet, No One Knows You're a Dog. A lovely plain cartoon. It just shows two dogs sitting, typing away at a computer, grinning at each other with the on the Internet, nobody knows you're a dog. I can't do it because the US suppliers wanted a hefty copyright fee, but you can pick it up on Google and you may want to look at that later on. The point is, this is a really good illustration that you can never be sure who's behind what is provided on the Internet, be it health information or otherwise. But in health information, as librarians, library staff, we praise the site before we use it, and many of us are aware of the tools and the research to aid this. But the public, well, the quality of information is often in the news. Don't use Wikipedia for medical advice, warns The Independent after a survey found factual errors in 9 out of 10 articles about common medical conditions. It concluded, the most important thing to take away from this study is the need for caution when using the Internet for medical information. To question, patients and the public need health information. over the past number of years, the ethos of medicine is shifting. Moved away from a more paternalistic view of where to the doctor and they tell what to do, and do it, to a model of partnership where doctor and patient work together and they share treatment decision making. So there is a need for patients to be more aware of the quality and reliability of health information named on the internet. This would empower them to find information for themselves and more involved in their healthcare needs and decisions about their treatment. Save them some anxiety from false information. It would save clinicians time from correcting misinformation, and it makes patients money and, more importantly, potential damaging side effects of buying misleading products. This shows a quote from the Patient Information Forum, Make Case for Information. It case really clearly. I'll let you read it. The report aimed to identify the evidence, the benefits of providing and the harm of not providing high-quality health information. And let me give you a practical example of this. When I worked as a clinical librarian, I had a query from a clinical nurse specialist. Her patient was having very odd side effects. We were convinced it wasn't happening by any treatment that she'd had, as she'd already finished that particular course of treatment. She was having stomach issues and was losing her hair and some other skin problems. Fired, she was using apricot kernels. This had cited as something that may cure cancer or have a protective effect. She'd bought it from a site that she'd come across on the internet, and she was eating up to 5 a day. However, kernels contain natural were metabolized into cyanide, so she effectively had toxic effects from having too much cyanide because of something that she'd read on the internet. It is a true example and shows really clearly what happens if people don't know where to look for the information that they need. Also had a positive impact on service utilization and healthcare costs. It had an impact on patients' experience of healthcare, and the information also had an impact on patients' health behaviours. And all of these are important facts in the current health situation. I believe that we in NHS libraries are uniquely positioned to help with this part of the patient journey. But alongside this, there are other barriers to health information. These. So the fact that people don't know where to look. We have difficulties around medical terminology. This is not only due to the fact that they're looking at sites that may not be written at an appropriate level, so people's understanding of medical terminology. There's also difficulties of knowing what to believe, and in fact for Macmillan this has become such an issue that they employed a nurse especially to try and combat some of these cancer myths, and also the health scams like we've just discussed. Offer in NHS libraries. Well, we're uniquely positioned to provide healthcare for the public. We can play a role in providing evidence for patient care as part of service to healthcare staff, so an indirect role. But we can also act as signposts to the information that the public and patients and carers need to empower them to be active participants in their health and well-being, or direct role. I would trust only to doctors, but they're frequently used by the hard to reach. On to look at resources and techniques that may help you in your role when you're signposting patients and the public, or indeed when you're assisting healthcare staff with their patient information. Our is made slightly easier as there are quality standards for consumer health information. You may or may not have come across these. The two most common ones are Standard and Hone. The Indian Standard is produced and regulated at the moment by NHS England. Most UK sites that are trustworthy. Is more used in Europe and America. And again, to get websites have to actually go through a very rigorous checking process. It is used for website information. You can also see it on printed information. Websites which display the information standard, and these would be my first port of call for any consumer health information query. Very be aware of NHS choices, but will tend to use patient.co.uk. PPI is put together by GPs, and these two websites tend to complement each other. I'd like a few minutes is just highlight a few sections from each. This is exhausted, an survey study, but I would suggest that when we've finished, that you go away and have a look at these yourself. So, NHS choices. Key areas that I always use or signpost people to, the 8 head of health. Very easy to use, easy to navigate. Each section is well set out and follows the same pattern with overview, causes, and treatment. And all contains some prevention issues. About health information, we've also got to consider in this day and age things about prevention. So a live well section, and again, there's information there on eating well, health, cooking, and all of these are very key issues of our trusts. And again, we can signpost both healthcare staff, worth signposting this care staff to is the health news. If you looked at this section, then I do commend it to you. It's health information that hits the news daily. For that, we were all hearing about omega-3 disease. It was both in the Sun and the Daily Telegraph. But each of these appraisals follow exactly format. It goes into detail about the type of research, what it involved, results, how it interprets them, and comes up with a conclusion. The patients that I'm with really do find this particular part of the website exceptionally interesting. Lastly, one section that is less easy to find, if you navigate right to the bottom of the page, you'll find our information standard. I wish they put those at the top of the page. It would make it so much easier for all of us. But here, on some really sections, talks all about what complaints, healthcare costs, healthcare abroad. But more importantly, if you're thinking of rolling out a section for our own, for example, staff, CPD, or there's a really, it covers mostly what we'll cover today, but it's really useful about becoming a confident internet user, health information, and also a small section on being safe online. Looking at from this section, you get again a very useful for patients. Patient.co.uk. Then it's got an A to Z of health, but the nice about this and where it differs slightly from NHS Choices, you will often find more pictorial information and more videos. So again, depending on your population, it's a useful one to use in conjunction with NHS Choices. On back pain, as you tells you exactly what it does, but talking with a video, and here you're getting more pictorial information. Very useful to use in for medical professionals, and sometimes the more informed patients that I meet do find this particular section gives them that little bit more information. So again, at the A to Z list, if you look here, it's talking about back examination, back pain in children. It does say that it's for medical professionals, but if you notice, it looks at things like epidemiology, differential diagnosis, so slightly more in depth. It is written for medical professionals, but just sometimes a lot of the more informed patients find this really helpful. Said, it's worth using both of these together. But what about sites with no quality standards? We use a very extensive tool to appraise, such as Discern, and the Discern instrument you will see questions to ask yourself when you're appraising your website, or you can work out how I get back to my main screen. Work a very, very simple solution that I've developed when working with patients. www. Very easy to remember. Who, what, and where. So, if you think of who others, who's publishing it, what are their qualifications? Back to our Steiner cartoon on the net, nobody knows you're a dog. First, establish who has put that information on the site. All sites should have an About Us section, which is very clear on who's putting that information up there. Choices does it beautifully. If you About Us section, you get this page here. Do all that you need to know. It tells you about how they work, who their editors are, what they're trying to do, what their updating policy is. It's very, very transparent. Look at what is on the site. Is the information relevant to the subject, or promoting a service, or trying to sell you something? And so it's really difficult to work out what they're actually trying to do. Are there evidence links on it? Is it up to date? Link.co.uk. Here's an article on asthma. You can see who's author what it's setting out to do. Very clear. Not trying to tell you any inhalers or treatment. Tells you what it's trying to do. Is it? Well, but it was authored in 2016, but we're in 2018. Down, you will see that editors note the NICE guidelines released in November 2017 actually had a significant change to practice, and that was incorporated in the article. If you further down, further in references, they make it transparent when to obtain the information. When it was checked, wait for next review, who authored it, peer reviewed it, and then the important information standard. And lastly, you need to know where the website has been published. A website you mind is okay on the who and the what, but it's from another country. You may have to use it caution on whether the treatment, the medication, or are applicable to this country. Use clue in the section to start off a clue if you look at the web address. And as you see here, I've just given some easy examples. Simple format. I quickly work through whether I want to use the website for health information, and then patients find it a useful way as well. So what can you offer in your role as a library assistant in this area? Well, remember, your contribution to PPI may be with direct contact with patients. That is, your library is open to patients and the public, or be indirect through your support of healthcare staff. Often the first point of contact for staff actions. Section to highlight some of the resources that the PPI Task and Finish Group developed, which you may find especially useful. Course that we developed as part of that Task and Finish Group guidance. You can look at this on the following link, and remember, we are making this available after the session. You'll see there is a tab here for patient and public information, and this takes you through all the various sections of the guidance. What I like to do, though, is not spend time on this, suggest you look at it later, but actually spend time just looking at 3 areas of the guidance, which I believe you may find really useful. So the inquiries, and perhaps you might want to print some of these off and use them with your own teams to set up some in-service training that's useful to have as a printed version to refer to. So let's look at these. Section we put in because it helped you determine some of the boundaries, and so it was trying to answer some of the questions that we were being asked. You must remember that we're not qualified to advise them about individual health aspects, but we're only to signpost them to information that they would have been able to find themselves had they have known where to look. Various things on should we make resources available to them, whether we can give them open access to e-resources. Answer the query, or we can't lend them the book that they particularly wanted, that we could perhaps refer them to their public library for that particular resource, or an interlibrary loan for the particular article. But from this, again, we had some queries directly from library assistants. So what we did was we put together a guide for you as well. This in conjunction with dealing with inquiries, but it does have a little bit more information on what your role is. And again, we need to remember that we need to treat any information given to us like we would with any member of our team. But those logical things is why patients and the public visit your library. You welcome them. What if your patient is upset? The person wants reference access. Do is print this out and have a discussion with your own teams when you go back. Help public. You don't have to reinvent it yourself. There are lots of resources on this website that you you, as long as you acknowledge the original. It's for partnership and networking. Some workshop materials. They're really designed for other library staff, but you may find them useful if, for example, you go out and you want to start doing some partnership working with library assistants, or you need to help your librarian find the resources they need for such a course. But training resources, and again, these can all be used with our patients and the public. Really helpful for training is this self-information workbook. This has been developed by Doncaster. Again, adapt it with acknowledgements, but it tends to list all major websites, but then some questions at the back that you can use as a workbook. It does as a Word document, so you can adapt it yourself. If you have any trouble getting it, I've got a copy of it. Leaflet that I developed for use with my patients and public. And please feel free to edit it. A number of trusts also already have. Very useful guide to NHS choices. I do believe that this may be updated because choices are changing quite rapidly. So you take some time to explore all of these after today's session. Just finish. And we've all been involved in information. Here in the site, we put a special edition of the swimming pool. This great source of ideas, things that we can replicate. And what I think will happen is that everybody will submit again what they've done this year, and we can put together something similar. Because again, these will list what people have been doing, and it's a great way for us to be able to help in future years without having to think of new ideas each year. Hopefully, you're more aware now of why patients and the public need our help to support them to quality reliable health information. And feel free to use the www format. You know which websites are helpful to look for guidance and resources. My inability to find my way back to my PowerPoint, despite the fact we practiced last week, girls. Thank you very much for participating today, and I think we've now got any questions.
Oh, thank you, Caroline. That was great. I know Nat and I, when we listened last week, we thought it was great, and it was really useful, and especially the useful resources at the end of the session. So thank you very much.
Thank you, Caroline.
Has any questions at all? If you could type them in the box, we could see them. We'll just for a few minutes just to see if anyone's got any questions.
And I think, there we go, the chat. Let's have a look.
At the moment, you can't see anything now?
So far, nothing. But let's have a few moments for people to think and consider any questions that they may have.
I was just asking, and it's Morgan Johns, where will the PowerPoint slides be available from? We can send them to people, can't we, Nat? But I think this session is going to be recorded as well, isn't it, and be on the LibGuide site?
It'll be available, the recording, but I have a list of everyone's emails, so my plan is tomorrow after the librarian session to email out to everybody the PowerPoint slides.
There's a lot of useful information in those.
Certainly.
I was just saying email would be fantastic. So we can sort that one.
Lovely.
A couple more. You were saying that you've already used, from when we were last week, you've already managed to use some of the resources that Caroline suggested for something that you're doing. So I'm hoping we'll be able to use
has left the meeting.
Caroline's www acronym is succinct, works very well with carers. So thanks for Carol Ann for letting me use that slide. It did work very well.
Good. Karen's also said very interesting session, so thank you, Carol Ann. Oh, here you go. Do you recommend other sites? And Health Locker? Can you as well, Nat?
I can't. I think it's
Patient Public Info. Have you heard of that, Carol Ann? Is it Health Locker WebMD?
Health Locker. That's Erican, I'm going to guess.
Is Carol muted, is she?
I don't think so.
No.
I've personally not heard of healthlocker.webmd. Websites, I did a talk last week, but it was mental health was the focus. It was things like rethink.org.uk, mind.org.uk.
Right. I'm just saying that it's to do with Boots. I take it that's Boots again.
Boots
okay.
Yeah, I've used that one, but I'm always wary because they do tend to advertise lots of products. So whilst some of the information can be useful, you've just got to be a little bit wary of the fact that sometimes products are advertised at the same time.
Okay.
I think I was muted.
You were muted. I didn't think you were, but maybe you had become muted somewhere along the way. Mina's just saying yes, thank you. Something to be wary of, I suppose, is the advertising, Caroline.
No, yeah, and also that Boots site does have an American side as well as a UK side. So again, it's making sure which part you are on if you are going to use the information.
Thank you.
So if you use NHS Evidence, there are some useful links to patient websites on NHS Evidence. You can actually filter by patient information on NHS Evidence. As I say, today I could have spent 2 hours doing a session and talked through lots of different sites, but I chose to stick to the 2 I tried and trusted for me. But if anybody does want to have a look through NHS Evidence and filter on the patient information side, and you'll get lots of other accredited sites coming up.
Worth having a go.
What I'm thinking as well was some NHS trusts and some places have subscriptions to things like Up to Date and Dinamed. So I do believe that there are patient leaflets, patient information available on those websites. I'm not sure how they are, but I think that might be another option, that we could print those leaflets off and hand them to patients, carers, should they wish. What do you think, Carol Ann?
Yeah, I've done that in the past. Again, for basic level patient information, and there's a more advanced level patient information. Lots of our medical students find the more advanced patient information leaflet very useful. And again, if you've got what's called an informed patient group, sometimes they can find that more advanced level really, really useful. But you can print them off. But also, don't forget all the patient information leaflets that may exist within your trust. So again, you may be able to signpost people to and some libraries administer those particular leaflets. So again, don't forget about those as well, that you can use for anybody that pops in.
With a question come through, and it's how do we make patients aware of all this information? I mean, personally speaking, if as library staff, if we get asked to go out and give talks to care groups, we can get information there. I
agree with you if you were asked to do that, but what I've managed to do, and that's a leaflet I showed you, finding quality health information on the internet. I've managed to get that as one of our core trust leaflets. And that particular leaflet, which talks through a little bit of what I did today on the quality standards and the www, that's now one of our core leaflets. So it's in most departments throughout our trust. and I know it's used because we've got to continually, we buy it. So to make sure that it's the right version and it's not just photocopied. We have that readily available in our library, but we also, as part of Health Information Week, we took a leaflet round with extra copies to all the wards, and we keep getting asked for it. So that is another good way to make sure patients are aware. But the best is to be able to do a patient support group, because that's a really good way to have interaction with patients and get out there. Very receptive.
I've just a comment from Mina, actually, Caroline, and just saying, would it be possible to share that resource, that leaflet? And she not a pirate, but just to have a look at.
Most people have pirated it and used it with an acknowledgement. So feel free. So what we can always do, I can send you the current PDF should be our site. That I showed you where all the resources sit, but it will find it. We can certainly set out with the PowerPoint.
I'll do that tomorrow afternoon. So we'll get the PowerPoint and your article, your leaflet there, Caroline.
I've got another question as well, from Alan, and just saying, what about partnerships with trust spells? What's your thoughts on that?
And if you can develop one, that's a really, really good way, because again, they can often either they can signpost patients to you, or they have copies of my leaflet. So any way that you can work with PALS is really useful. What I've managed to do is get a standalone PC in the library that's not networked to any trust systems, which I've made our consumer health PC, and that was partly through support with PALS, so they could send any patients down that wanted to look at health information, again in a non-threatening, quiet environment where they could sit and just review at leisure. So it's really worth, Alan, trying to develop those relationships and partners.
That's good. Another question, actually, from Mina again, saying, what do you think of partnerships with public libraries? Maybe recovery colleges, where is one?
I haven't got much experience with recovery colleges because we don't have one in our mental health trust. I know Jackie Webb from who does lots of patient initiatives as part of her recovery college. In terms of partnering public libraries, we have started partnering our public libraries, and as such I've done 2 training sessions for their library assistants to try and upskill them so that they know what websites to use. When we did that session with them, they didn't know about the information standards. They knew a bit about NHS choices, but they didn't know about patient.co.uk. What we're also trying to do is they've allowed us to put a display up in our public
We've
round about finding quality in the public library as well.
Thank you. Pretty good. Lots of things going on, Caroline, from people.
Can I say that library assistants in public libraries didn't realise that there were librarians and library assistants in NHS libraries?
Oh my goodness. Wow. So, other than all your thank yous you're getting now, I think that's about it. That's it. No more is that from your end?
I've got nothing my end, Chloe, no.
I think we could probably bring the session to a close now. Well, thank you everyone for taking part. And thank you very much, Caroline. It's been really interesting.
Apologies for my, I know we practiced it last week, but I just had a blank on which button to close.
It's been really good. Thank you. Thank you very much.
Caroline,
thank you, everyone else.
And thank you for joining us.
That's fine. I hopefully will try and be perfect tomorrow.
Oh, that's fantastic.
It'll be lovely.
Okay then, so if people want to start signing out, that's great.
Thanks, Chloe.
I'm going to stop recording now then.
has left the meeting.